Speckled
Joseph
appearance
that
of
one
my
that has
partner.
like the stained glass. and
Yes,
everything.
ma'am.
Speckled appearance of
Is this a check all of the, oh, jeez. There's one more.
It says findings with the S, so.
Yeah, there's one more.
Hypertrophy? Oh.
I would say, good, Becky, I agree with you. Alex, take this one too. But I would say, yeah, it's definitely hypertrophic, for sure. But I would also say, reduced strain too. I'm not doing the math. However, if it's 2.3, but it does collapse, what's the RAP?
Something like 38815 meters.
Yeah, so what would the RAP be? 8, yeah. If I was to guess, I'd say probably 52. 3.5 is pretty high. But I don't know that one, I'm not doing the math. I told you guys that from the get-go, I'm not doing the math.
Why are we so about like 840?
We shift the baseline up or down?
Down.
Is the flow going up or down? Down, yeah, so toward the flow. Mhm.
Too juicy. Seeing the patient.
Reviewing the physician order report?
Order. Or requisition, control sheet, whatever.
Half the time you ask a patient what they're there for and they say, I don't know.
Yeah, right. Oh. Doctor told me to be, is it? What?
I said these questions are way easier than the ones on URR.
Yeah, the ones on URR, I was like, what the
Red
hell is this?
questions.
Good at you are. These are way easier than last year's CACI, just so you know. I should, you know what, I'll ask Veronica, she just took her test yesterday and passed. I'll see if she has any tips.
Who took it?
One of my older students.
Oh, okay.
Good for her.
Is it Fowler's? It's not Trendelenburg.
No, it's not.
Sue Hardy.
Right peristernal.
Oh.
Not super. So, when you guys have seen me do the right peristernal, you know what, I'm glad this question, because I didn't teach this. So I'm really glad we did this. So when you do the right peristernal for the PEDOF probe, I don't make them move. But if you are, the answer is right. You want them to turn the opposite way. Because what you're checking is the blood flow through the aorta. But I can always get it supine. That's just me being lazy. The answer is right.
Is it aorta?
Is the aorta at the apex or the base?
Oh, okay,
Is it pulmonary?
It's mitral, guys. Mitral. Yeah. Take a picture. Because see, the tricky thing is, what's the largest and most apical?
Apical, so you mean at the top, it would be at the apex, right?
Apex is down here.
Base is on top.
Oh, okay.
So, I still say mitral, yeah, I'm going mitral. Cause it's the largest valve, that's the only, I mean, that's where your semi-lunars are up on the base, right? So your apical ones would be your AV valves, but your biggest valve is your mitral valve, so. Subcostal, alright, what's the best? First, we know is supine, right?
Mm-hmm.
Now what? Knees
Knees
slightly
slightly
bent,
bent.
very good. What measurement is this?
Pizza.
Pisa!
Subcostal and suprasternal.
These questions are ridiculously easy, and I really hope your guys' test is like this.
Me too.
Yeah, we can make the test. It's like, what?
Pericardial. Oh,
Wait, what is a?
Pulmonary
Pulmonary
hypertension.
I'm gonna tell you this, the only one who may know this is Alex, I think, because just of her profession. But the answer is A. So that's the, what do you call it? You have a generic name and then the,
brand name.
right, but what's the generic name actually? That's the generic name for Definity.
Oh.
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 That's what it's called. Definity is a brand.
Oh,
Yep.
okay.
That's what it's called.
I'm gonna take a picture.
So that means they're allergic to the contrast. That's obviously gonna be.
Oh.
If you didn't know that, I would have been like, essential IV, because you're really not supposed to do anything through essential IV, right? But this is what the medicine is right here.
So that's the generic of.
Yeah, that's
Okay.
that's the actual chemical name, like the medicine name,
Okay.
right?
Wow. But they don't use that name in the hospitals. They
They
just
do
say
not.
it's okay.
They do though when you're billing it.
Oh, really?
Yeah, like when
Okay.
I back when I worked at Beacon and I had a bill,
Mhm.
that's what it came up as.
Huh.
I don't know this.
These are like the type of questions that were on the URL.
I don't know this one at all. Alex, you got it?
I don't like they don't tell you if you got the answers right or wrong.
I know, right?
It's not cool.
I'm gonna just say this, simply because if I don't know if you've ever noticed, but 50 is sort of like the standard frame rate, right?
Mhm.
I don't know the answer to this. Sorry. I don't know everything. Is Nadia sleeping?
No.
Yeah. She said, no. Alright. After administration, what should the patient be instructed to do?
Resume normal activities.
Yeah, exactly. Yeah.
Drink plenty of food.
Yeah, the half time is like minutes. And you don't, and let me tell you about the drink plenty of fluids here. For those of you who haven't heard me explain contrast to a patient, when you have Definity, you only metabolize the saline because the perfluoride is actually gas. It's a gas. They're bubbles, gas bubbles.
Mhm.
So the patient, every cycle of the lungs, some of those bubbles pop and you exhale it out. So drinking fluids isn't gonna get it out of your system any sooner. So. Fascinating, actually, if you ask me. I don't know this one. I can look, but I'm gonna be honest with you guys, I don't even have the pressure I have time on here. So I don't know. Alex, you wanna take a picture?
Mm-hmm.
Yeah, I don't know this one.
Short
All of them are the short access. All of them are leaflets of the aortic valve. Ooh, good one. Whoa, wait. Hold on, Alex.
Gonna be like focal core.
So I would just say this because I'm guessing, right? I was gonna say some, first, if you just were to ask me with no multiple choice, it's subcostal. Yeah, I don't know this one. Sorry. That's why we do.
The third one.
Mhm.
Just another cardiac.
Yeah, has anyone seen me talk about a thrombus push? When we do Definity in the LV, like, you know how you bring the LV in real good, and you administer real slow, and you do that, and then you get all your Definity pictures that you need of your LV, and then I go back to the 4-chamber and I push it fast. Because you know how I say you don't wanna push it fast, cause it collects all at the apex. You don't want that, you want the whole apex, imaged. This is a trick, by the way, this isn't protocol, this is a trick. But if you're suspicious of a thrombus, I go back and do that again, because now you actually want it to all collect up top, because you're looking for an apical thrombus. So yeah, apical thrombus for sure. Alright, so this is most consistent with, I can tell you just by looking at this picture right now. You can see it. AI, yeah. Do you guys see the AI now?
Yeah.
So it's going opposite direction of flow, so that's insufficiency. Take a picture, I'm just gonna say, I'm gonna just say St. Jude, just because that other question said St. Jude, but I know they do mechanical valves. But why do we have to know the name brands of valves? That's the dumbest thing I've ever heard. That's stupid. I don't know what this would be. Because the time gain is for the difference between like time and depth, right? So would that be divergence? Alex?
I took a picture.
Alright, the number circled on the color Doppler
They look almost the same.
scale represents the maximum. I mean, you should just know without even having to look at the damn picture. So what does this number represent?
Close scale.
Of the four,
Aliasing valves?
aliasing, yeah. Yeah, so if you go above 60 centimeters, 61.6 centimeters a second, you're gonna alias. This is the Nyquist limit. Okay, does that make sense, everyone?
What'd you say? What was the number?
Or whatever the number was circled.
Oh, you couldn't see it?
Yeah. What is one significant benefit for using 3D?
More accurate ejection fraction value?
I would 100% say that, because we did the heart model, that's 3D. 100%.
Assessment of the cardiac rhythm.
No, that's the Mueller one.
That's right.
Remember I said we Valsalva for obstruction and bubble studies.
Mm-hmm.
You guys, have you ever seen me when I do a bubble study? I do it, and then I push on their stomach. Have you ever seen me? I push on the stomach. That's pushing on the stomach is what's the word I'm looking for? Mocking Valsalva. but you have to do fast, and patients are like, you tell them to tighten your tummy like you have to poop, and they're like, huh? Like they get all confused, you know? So I just push on their belly. Because what you're checking is, if that hole's real small, the change of pressure, you're right, it might show an ASD within that change of pressure. So that's why I have them. Or I don't know if you've noticed, like even when I'm checking in the subcostal, I have them inhale and hold it. Then I hit record and have them exhale, so you can see what the color looks like through that change of pressure. So that's
So you said Valsalva's bubble study and what else?
obstructions, yeah. With tamponade, you're just looking at the difference between inspiration and expiration.
Left main coronary artery.
Which one? The lateral? So we have the left anterior, circumflexed. Alex, just in case, but I think it is left main. Alex?
I got it.
Which one will give you the best? Oh,
Barrel
read the
chest
rest of the
individual with.
individual. Okay, so gives you the best information regarding left ventricular function on a barrel-chested individual with emphysema. It's a really good question.
Is it subcostal?
Subcostal, absolutely. It's subcostal. So we all love our COPD, emphysema, asthmatic patients. Lung attenuation's our favorite, right? No.
Yeah.
However, whenever you have those lung issue patients, your apicals are shit, right? But in your subcostal, you can see systolic function really good in that four-chamber. You get a really good four-chamber down there. Is it ideal to use? No, but if you can't get good apicals, right? And contrast isn't gonna help. If you can't see the structure, contrast isn't gonna make it appear, right? It just defines your endocardium. So yeah, that's gonna be subcostal. You can do short axis in subcostal. You can do it all in subcostal, I have. All right. The resistance against with which the ventricle contracts is known as what?
Preload?
Afterload. All right, what film, whatever structure that you see mobile there? So we're looking right down here, guys. See this right here? See that little thing floating around over there? What is that?
Is that a veggie?
No. This goes way back to the early days.
It's
Yes.
you know why? Because that was on the freaking.
Oh yeah, yeah.
That was on the,
So this is stuff back from a year ago, you guys. You know, so. And then you can see the eustachian valve down there sometimes floating around. Come on. He's,
Left atrial appendage.
yeah.
External wall manifest?
Wait. Both great vessels. What- But both great vessels? The great vessels or the vena cava,
would it be able?
do you know what I mean? Like, that's a strange question. I'm gonna say subcostal. Yeah, but,
But isn't it aorta and pulmonary vein, or pulmonary
I mean,
artery?
yeah, you can get them all in the subcostal. That's the thing.
Okay.
It should say all of the great vessels, not both. Like, I don't like that question, because your great vessels are your IVCs, your aorta, pulmonary artery, pulmonary veins. if hold on a second,
The only
window.
reason I think that it's like the great vein vessels is like that whole transposition thing, so like pulmonary artery and just the aorta.
Alex?
I got it, I took a picture of it.
Cause I'm wondering if short axis, cause it, no, it's gotta be subcostal.